Everyone, this is Ben with Cholinergic and in this video I just want to real quickly answer a common question that gets asked on the forum, which is what type of doctor do I need to see when I find out that I've got this problem? And there's two doctors you might want to think about seeing. One is a dermatologist and the other one is an allergist. Those two types of doctors seem to be the ones that are going to be most familiar with this condition. And a dermatologist specializes in the skin, and allergists, they're just going to be more familiar with the different allergic disorders out there and food allergies and so forth. I've never been to an allergist. I, in a sense, find it kind of pointless at this point to get a food allergy test or to have anything like that done, but they can be beneficial for those of you who want to do something like that. I pretty well know what causes food issues for me, but if it's something that you want to explore, the only problem with those food allergy tests is sometimes I don't catch everything because they can't really test you for every sort of food out there. So, and sometimes it can be a false positive or a false negative, so they're not always conclusive. But those are the two doctors you want to see. Now, when you go to a doctor, you probably want to take pictures of your hives reaction if you can. That might help them diagnose you a little bit better. In most cases, they're just going to ask you questions for the diagnosis. They can sometimes perform what's known as an exercise test or exercise challenge test, I think they call them, where they'll have you exercise or do some physical activity and they'll kind of observe your signs. If they can see hives on you, wheals, and then they disappear, or flushing of the skin or itching and then they disappear, then they'll probably diagnose you with cholinergic urticaria. So you might want to take those pictures, and that's what you maybe can expect during a diagnosis. It's really hard to get diagnosed too, I should say that. Only later on did I really get diagnosed, and it was just kind of like, yeah, you have cholinergic urticaria. But the first few times I went to the doctor, they didn't even attempt to tell me what was wrong. They really acted like they didn't know what was wrong with me. They just tried to, throw antihistamines at it and throw this medication at it, throw that medication at it to try to mask the symptoms. So that's another thing. It can be frustrating to get properly diagnosed, and the average doctor out there knows very little about this disorder. In fact, most of the population knows very little about these physical types of hives. So those are the two doctors you want to look into if you're thinking of going to a doctor. It's always a good idea to get some blood work done. Most people that have cholinergic urticaria, when they get blood work done, it usually comes back really good. And that was a frustrating thing for me. I had blood work done, it would come back, and I was the healthiest guy in the world that was so terribly unhealthy with this itchy disorder. So that's something that you want to keep in mind, but it's always a small possibility you have a hormone issue or you have, something else that they can find in it. So that's it for this video. Allergists or dermatologists, thank you so much for watching and have a great day.